federal government approves Pfizer's application for emergency use authorization of its COVID-19 vaccine, healthcare workers and first responders at UCSF could be the first to get it before Christmas.
We expect it to come on board physically at around the second week of December if all goes according to plan.
UCSF and Zuckerberg San Francisco General Hospital are two of just 7 California hospitals chosen to get the Pfizer vaccine first if it's approved. UCSF infectious disease specialist Dr. Peter Chin Hong tells us that the hospitals on the list are all holding meetings right now to decide how it'll be distributed and who exactly is at the front of the line to get it.
So they include those who are working in the emergency department, those in the intensive care units, certain specialists like infectious disease doctors, pulmonologists, certain staff members or therapists like occupational therapists.
Dr. Chin Hong explains that the coronavirus vaccine has to be stored in really cold temperatures and that UCSF already has the special freezers it needs ready to go. He says the military will be involved in the process to ship the vaccine to each facility, but that those plans are still a work in progress.
Even though it may not get into the arms of most Americans until maybe the end of late spring or early summer, it is something to hold on to as a metaphor or a symbol of, how far we've come.
Once the vaccine is available for the general public, Dr. Chin Hong expects it'll be free for everyone and could be available at places like Target, CVS, and Walgreens. But at this point, health experts don't know if the shot prevents someone from passing the virus to others. So they recommend you don't ditch the mask just yet. Also, you'll need 2 doses of the vaccine to be protected from COVID-19.
You're going to get some protection after the first shot, but the best protection and the best probability of protection is going to be there about 28 days after the second dose likely.
Some of the possible side effects of getting the vaccine include fever, muscle aches, and headache. Dr. Chin Hong says more than 70% of us need to be vaccinated before we see community benefit, but that this could be a big step in the right direction.
It's a huge deal. It's been long coming. I think it's the light at the end of the proverbial tunnel.
In San Francisco, Anoushah Rasta, NBC Bay Area News.